When you think about surviving a really serious illness, you probably picture a finish line, right? That moment you're finally cured. But for people who survive Stevens-Johnson syndrome and toxic epidermal necrolysis, getting out of the hospital isn't the end. It's actually just the beginning of a whole new fight. I want you to just imagine this for a second. You take a pill for something super common, maybe gout or an infection or even epilepsy. But instead of making you better, it sets off a full-blown medical catastrophe inside your body. Well, that isn't hypothetical. That's the terrifying reality for people who get SJS and TEN. So what are we actually talking about here? Stevens-Johnson syndrome, or SJS, and its even more severe version, toxic epidermal necrolysis, or TEN, are basically catastrophic reactions to a drug. Your own immune system gets confused and launches this all-out attack on your skin and mucous membranes, causing them to literally blister up and peel right off. Now, it's not like SJS and TEN are two totally different things. It's better to think of them as a spectrum. And the main difference, the thing that decides the diagnosis, is just how much of the body's skin has detached. If it's less than 10%, it's called SJS. If it's over 30%, it's TEN. And anything in that middle zone between 10 and 30, that's called SJS/TEN overlap. So what kind of drugs can kick this off? You might be surprised. We're not talking about some obscure experimental medications. It can be allopurinol, which is used for gout, some pretty standard antibiotics like sulfa drugs, common epilepsy medications, and even some NSAIDs you can get over the counter. It really just shows you how random and terrifying this reaction can be. All right, so we know what it is and what might cause it. But what does that initial attack actually feel like for the person going through it? Well, to put it mildly, it's been described as a medical firestorm. During this acute phase, the immune system just goes haywire. It attacks the skin and mucous membranes with such force that the top layer of your skin, the epidermis, just dies and starts to separate from the layer beneath it. It literally sloughs off in sheets. The result is just agonizing, and it looks and feels almost identical to a severe third-degree burn all over the body. And this isn't just on the skin you can see. The attack also hits all the moist linings inside your body, the mucous membranes. This means excruciating sores in the mouth and throat, making it impossible to eat or drink. It causes severe inflammation in the eyes that can easily threaten your vision. And it leads to ulceration in the genital and urinary tracts. It is a full-body crisis. Just surviving that initial onslaught is honestly a miracle of modern medicine and human willpower. But that firestorm, it leaves behind a totally changed landscape. And we're going to start with the most obvious aftermath, the scars left on the skin. The scale of the long-term skin damage is, well, it's hard to wrap your head around. In some studies, up to 100% of survivors have chronic skin problems. 100%. That means pretty much every single person who makes it through is left with permanent daily reminders on their own skin. And what does that look like? Well, you're talking about permanent changes in skin color, leaving light or dark patches. Thick, raised scars called keloids. Many survivors deal with chronic, maddening itching. Their nails might fall off, grow back deformed, or just never come back at all. And many develop a brand new, intense sensitivity to the sun that completely changes how they can live their lives. But the damage goes so much deeper than the skin. In fact, maybe one of the single most devastating long-term consequences has to do with the eyes. Get this. Up to 3/4 of survivors, 75%, are left with serious, often disabling eye problems. And the research is really clear on this one. For many survivors, these chronic eye issues are the single most disabling complication they have to live with. We're talking about a range of things, from incredibly painful, severe dry eye to scarring on the cornea itself. And in the most tragic cases, it can lead to partial or even complete blindness. The visible scars on the skin, in the eyes, are devastating enough. But some of the most serious, life-altering consequences of SJS/TEN are the ones you can't see at all. The hidden damage that's done to the internal organs. This quote from a big review in a dermatology journal really hits the nail on the head. Doctors are realizing more and more that surviving the initial attack is just the beginning. The chronic phase of this disease can mean a whole host of new problems popping up years later, affecting everything from your lungs to your stomach. And one of the scariest delayed complications is a lung disease called bronchiolitis obliterans. You might have heard it called popcorn lung.
What's happening is that scar tissue is literally forming inside the smallest airways of the lungs, blocking them off. And the scary part is, it's progressive, and it's irreversible. And if you look at this CT scan, you can see exactly what that damage looks like. Those cloudy areas, that's all consolidation and scarring inside the lungs of a TN survivor. It's a permanent reminder of the disease, a constant daily battle just to breathe. And it doesn't stop with the lungs. The damage can be systemic. We're talking about scar tissue in the esophagus that makes it hard to swallow, painful adhesions in the urogenital system. Some survivors even develop chronic kidney failure and end up needing dialysis for the rest of their lives. So, when you add all of this up, the visible scars, the hidden internal damage, and just the sheer memory of the trauma, what does it actually mean to live your life as a survivor? It's a journey that touches every single aspect of your being. Now, this number is a real gut punch. You'd think that once you're discharged from the hospital, you're in the clear, but that's just not the case. One huge study found that the mortality rate for SJS/TEN survivors at the 1-year mark was 34%. It just shows you how medically fragile people are, even after they've survived the initial crisis. And of course, living through something that traumatic leaves behind deep psychological scars. Survivors have much higher rates of depression and PTSD. And think about this. Many develop a persistent, irrational fear of taking any medication ever again, which you can imagine makes getting future medical care incredibly complicated. So how on earth do you care for these patients? It's clear that the only way forward is with a whole team of specialists working together. You need a dermatologist for the skin, an ophthalmologist for the eyes, a pulmonologist for the lungs, other specialists for internal organs, and crucially, you need a psychiatrist to help with the deep psychological trauma. And this really brings us to the biggest takeaway of all. SJS and TEN are a brutal reminder that for some illnesses, survival isn't the finish line. It's just the starting line of a marathon that lasts a lifetime. And it forces us all to ask a really important question. How do we get better at caring for survivors, not just when they're in the ICU, but for all the years that come after?